Hello dear students, welcome back to pharmacology. So in this session, let us see what are all the questions which were asked from pharmacology in INICET November 2022. So myself, Dr. Padmanabha. So let us begin the pharmacology recall and let us see which are all the questions that were asked, and we'll also find out the appropriate answer for each of these questions. So starting with, so this was the question which was asked. So a patient with erectile dysfunction was prescribed sildenafil. So what is the mechanism of action of this drug? So the patient is having erectile dysfunction and he has been prescribed with sildenafil. So these are the four options. Please remember, sildenafil is the selective, it is the selective phosphodiesterase 5 inhibitor. So what this phosphodiesterase 5 is responsible for? Please remember, phosphodiesterase 5 converts the cyclic GMP into 5' GMP. So phosphodiesterase 5 is the enzyme which is involved in conversion of cyclic GMP into 5' GMP. So this sildenafil will going to inhibit this enzyme. Thereby what happens to the cyclic GMP level? Cyclic GMP levels will increase. So these increased cyclic GMP will enhance the activity of the nitric oxide. Since this nitric oxide will going to cause vasodilatation in the corpora cavernosa, thereby it leads to erection. Also apart from this is also used in case of the pulmonary hypertension. So please remember, for this question the answer will be the D. So nitric oxide and cyclic GMP. So it acts by enhancing the activity of nitric oxide by increasing the levels of cyclic GMP. Moving on to the next question. So second question is, a patient who is on antiretroviral therapy after 6 months develops hyperpigmentation of hand and foot. So which is the drug which is responsible for this condition? So please remember, Zidovudine is a nucleoside reverse transcriptase inhibitor. Emtricitabine is a nucleoside reverse transcriptase inhibitor. Nevirapine is a non-nucleoside reverse transcriptase inhibitor, and Indinavir is a protease inhibitor. So please remember, Zidovudine will going to cause nail pigmentation. Whereas the emtricitabine will going to cause skin pigmentation. And whereas nevirapine will going to cause skin rash, Steven-Johnson syndrome, as well as fulminant hepatitis. Whereas Indinavir will going to cause nephrolithiasis, urolithiasis, and will cause reversible hyperbilirubinemia. It can cause paronychia, that is nail infection, and as well as it can cause anemia. So what will be the best answer here? So skin pigmentation. So the answer is emtricitabine will going to cause hyperpigmentation of the hand and foot. So coming to the third question which was asked. So alkalinization of urine leads to increase in excretion of. So whenever you do a alkalinization of urine, so which is the drug which will be excreted out. So please remember, if there is a weak acidic drugs, if there is a overdose of weak acidic drugs, if you want to remove the weak acidic drugs, you need to alkalinize the urine, so that this weak acidic drugs in alkaline urine, they will going to form ionized forms of weak acids will be formed, and this can be easily excreted. Whereas if it was weak basic drugs, if you want to eliminate the weak basic drugs, you need to acidify the urine. So please remember, so the weak basic drugs in acidic urine will be converted into ionized form. What do you understand by ionized form? It is the water soluble form. Please remember, it is the water soluble form. Thereby it gets easily excreted. So here alkalization of the urine leads to increase in excretion of. So when do we do alkalization of the urine? Whenever we want to increase the excretion of weak acidic drugs. So the answer is weak acidic drugs here. So apart from that, please also remember which are all the agent used for alkalinization, which are all the agent which is used to alkalinize the urine. So you can use sodium bicarbonate, you can use sodium citrate, you can also use carbonic anhydrase inhibitor. To acidify the urine, you need to use ascorbic acid, or you can use ammonium chloride. You can use vitamin C, as well as you can use cranberry juice. So next, moving on to the next question, that is match the following. So Imatinib acts by inhibiting the BCR ABL tyrosine kinase enzyme. Basically they are used in the treatment of CML gist. So this is the answer for this. And sirolimus is the mTOR inhibitor, which is a immunosuppressant. Next we have a trastuzumab is a herceptin, where it acts through HER2 new receptors, mainly used in the treatment of breast cancer. So infliximab, they are used in the treatment of autoimmune disorders, where infliximab will going to inhibit TNF alpha. So it can be used in case of rheumatoid arthritis, autoimmune disorders. So next question, coming to the mechanism of action of the drug indicated in the image given below. So from the recall we can remember that. So this is the host cell, CD4 cell, host cell, and this is the retrovirus. Retrovirus. So what they had showed in the image was this point where this virus enters into the host cells, and just before integrating into the host DNA. So this was the point. So which is the target drug which will going to act here? So it is the integrase enzyme which helps in integration of the viral DNA into the host DNA. So the drug which can inhibit these activity is integrase inhibitor. So the answer here is the raltegravir. Raltegravir is the integrase inhibitor. So tenofovir is the nucleotide reverse transcriptase inhibitor. Okay. Nalfinavir is a protease inhibitor. Again, nalfinavir is a protease inhibitor. Lamivudine is a nucleoside reverse transcriptase inhibitor. Nevirapine is a non-nucleoside reverse transcriptase inhibitor. Indinavir is again a protease inhibitor. And enfuviride is a fusion inhibitor. Tenofovir is a nucleotide reverse transcriptase inhibitor. So here the appropriate drug which targets the integrase enzyme is the raltegravir. Next, moving on to the next question, that is a child, that is 14-year boy, presented with tachypnea and BP was 106 by 60 mm of mercury after a scorpion sting. So which among the following can be used for the management of the above condition? So here, so adrenaline is mainly used in the, it is the drug of choice for anaphylactic shock or anaphylaxis. Atropine can be used in case of vasovagal shock or vasovagal attack. It can be used in the treatment of bradycardia. Can be used in the treatment of organophosphorus poisoning. And next comes the prozosine. Prozosine is a alpha-1 blocker which is used in the treatment of scorpion, referred in the treatment of scorpion sting. And ivabradine is a funny channel blocker, or it is also called as bradycardia inducing drug. Bradycardia inducing drug. So where it is used, mainly it is used in the treatment of heart failure as well as in the treatment of angina. So here the answer will be prozosine. So next, moving on to the 7th question, peripheral blood smear shows sporozoites of plasmodium falciparum in RBC. Patient had brief episodes of seizures. So which is the treatment method here? So since you can confirm by peripheral blood smear the patient is suffering from malaria. So which type of malaria? Since he or she has got a seizure, it is the cerebral malaria. Please remember, for cerebral malaria, which is the preferred drug or drug of choice, it is the artemisinin derivatives. It can be artesunate, it can be artemether, it can be arteether. So these are usually given by parenteral route. parenteral route, IV or IM, IV or IM. So here the direct answer will be injection artesunate. So you can, previously they were using IV quinine, but artemisinin derivatives are preferred now because of their faster action, and it is more effective. Whereas the quinine was causing what? Hypoglycemia. So to prevent this hypoglycemia, so quinine has to be infused along with 5% dextrose. So tablet quinine can be used only in case of chloroquine resistant malaria. Chloroquine resistant malaria, especially in the uncomplicated chloroquine resistant malarias. So as you know that already the chloroquine has developed resistance in India, so you cannot use tablet chloroquine here. And doxycycline is used only along with the other drugs. So you can use in case of uncomplicated chloroquine resistant malaria along with quinine. So it should not be used as a standalone drug. So here the answer for this question is cerebral malaria. So the preferred drug will be the artesunate, not the tablet quinine. So next, coming to the 8th question, that is match the following with the drug acting on them. So here you need to find out the site of action of these diuretics. So they have asked the diuretics. So if you draw a glomerulus, okay, this is the proximal convoluted tubule, this is the loop of Henle, this is the distal convoluted tubule, and this is the collecting duct. So here, which is the drug which is acting at the proximal convoluted tubule? It is the carbonic anhydrase inhibitor, as well as the mannitol. So which drug acts here at the thick ascending loop of Henle? So it mainly blocks the sodium potassium 2 chloride cotransporter. So the drug which is inhibiting sodium potassium 2 chloride cotransporter system is the loop diuretics. And the drug which is blocking the sodium chloride symport at distal convoluted tubule is the thiazides. And the drug which is acting at the collecting duct is your potassium sparing diuretics, as well as the vasopressins. So here on the distal convoluted tubule, the drug acting is chlorthalidone. The collecting duct, the drug acting is vasopressin and the spironolactone. So loop of Henle will be acted upon by the loop diuretics, that is torsemide. So PCT, the acetazolamide will be acting at the PCT. So next question, again this was asked in your exam. So alkalinization of urine will help in maximum excretion of which of the following drugs? So option was acetaminophen, aspirin, digoxin and morphine. So please remember that in case of acetaminophen toxicity, there is a specific antidote. Which is the specific antidote? N-acetyl, N-acetylcysteine. Whereas for digoxin, you have a digibind, or we call it as digifab. For morphine, you have got opioid antagonist, that is naltrexone. So for salicylates or aspirin, so alkalinization of urine is done for the acidic drug, weak acidic drug. So this is the weak acidic drug. When we do alkalinize the urine, so these weak acidic drugs will be converted into ionized forms. Those are the water soluble forms. Please remember, those are the water soluble forms, and these water soluble forms can be easily excreted through urine. So here the answer is aspirin. So which of the following statement is true about memantine? So memantine is a CNS stimulants, where it is mainly used in the treatment of Alzheimer's disease as well as in Parkinson's disease. So memantine, so they are asking which is the statement which is true. Please remember, memantine is a NMDA receptor antagonist. It is also called as glutamate antagonist, where they are going to block the glutaminergic excitatory response. They are going to block the glutaminergic excitatory response. So used as monotherapy but not in combination with, so sorry, it is not the ACEIS, it is anticholineesterases. So it can be used both in combination as well as standalone drug. So here the option is they're used as monotherapy but not in combination. This is wrong statement. So they can be used in combination with anticholineesterases. What is the maintenance dose? Initially you are going to start with 5 milligram, not the 15 milligram. So it is preferred in mild diseases. So basically they are preferred in moderate to severe disease. So here the correct statement is it is a NMDA antagonist. So next, coming to which of the following benzodiazepine is preferred in liver failure patient with altered liver enzymes. So you need to find out the sedative which is preferred in a patient who is having deranged liver enzymes. So please remember, you can remember the sedatives which are preferred in case of benzodiazepines which are preferred in case of liver derangements. That means to say, in case of altered liver enzymes, can remember it as TOL. T stands for temazepam. O stands for oxazepam. One more T stands for triazolam. E stands for acetazolam, and L stands for lorazepam. Zepam. So which is the option which is present here?